Today we're going to be talking about cervical disc herniation. Some possible signs that you might see your patient walk in with include some mentalgic lean, some taking the pressure off of the nerve root. They might have some decreased range of motion when you test them, or they might have some hypertonicity in that area with the cervical muscles. Some symptoms that the patient might complain of include deep aching pain and in their arm. They could have it unilaterally or bilaterally. If they have it unilaterally, that's indicative of a lateral lesion. If they have it in both arms, that's more indicative of a central lesion. In the arm pain, it'll be a sharp, severe burning, or they could possibly have some paresthesias or weakness in that arm. A lot of times the pain is aggravated by coughing or sneezing or straining. A little bit about the anatomy. The discs of the cervical spine are composed of two major components, one of them being a jelly substance which is mostly water and some loosely packed collagen called the nucleus pulposus. The nucleus pulposus is surrounded and contained by a more fibrous layer called the annular fibers. A ligament of the spine runs on the posterior aspects of all the bodies. It's called the posterior longitudinal ligament, and this ligament separates the vertebrae and the disc from the spinal cord, and more laterally the nerve roots. The nerve roots are also susceptible to compression along the IVFs, which kind of run at a 45-degree angle to the bodies and the discs. A little about pathomechanics. Disc herniation is actually when that loosely packed collagen and the jelly substance tears through those outer annular fibers. And this can be caused by either traumatic or just insidious, poor posture, old age, things like that. In like a CAD injury, a cervical acceleration deceleration injury, the hyperextension can compress the disc, and the hyperflexion afterwards can cause tearing of the PLL, and which might cause it to herniate. Poor posture, like I said before, is also a cause of this. It adds additional unneeded stress to the cervical spine, and it can also decrease the IVF, which will compress the nerve roots. As you age, your elasticity and everything in the cervical disc and the ligaments kind of decreases, and you also lose water content, and this will make the disc more susceptible to injury. A little about the progression. At first you can have the degeneration of the outer annular fibers like we talked about, and it can be contained within the annular fibers, the nucleus pulposus can, or it can actually protrude through that and be uncontained, and oftentimes it can be a sequestered fragment. When the disc herniates to one side, it will compress the nerve roots, causing the patient nerve root symptoms like we talked about, the pain and the numbness. And if it herniates centrally, it will cause a bilateral like we talked about before. Special testing to test your patients for this. In times of trauma, you can use an x-ray in your office. This will kind of give you a look at just the bony parts of the cervical spine, so if there's encroachment in the IVF, or if there's any occupying lesions in that area. An MRI is really the telltale imaging for this, because you can see the soft tissue and you actually can see the protruding disc. You can also use a CT for any bony changes or things like that. Some associated terms that go along with the disc herniation include a broad-based herniation. And what a broad-based herniation is just a herniation that covers over 25% of the disc circumference, or there's a focal herniation, focal-based herniation, which covers less than 25% of the circumference. You can also have a protruded or extruded herniation. Protruded is when the base of the herniation is wider than the part that extends out, and an extruded is when a herniation goes out farther than the width of the base. Oftentimes you can have a free fragment, also known as a sequestered fragment, which a part of the disc is no longer intact, and so a lot of times the macrophages just eat that up. You can also have a contained versus an uncontained herniation. A contained is when that nucleus pulposus is still in the fibers, and an uncontained is when it's outside of those fibers. Some treatments that are often used in the acute stages are like rest, ice, and ultrasound will also help with decreasing a lot of that inflammation that is caused by the herniation, which causes a lot of your symptoms. In the subacute stages, you can use heat to decrease the spasms that they have, and then afterwards possibly doing some exercises to increase some stability and increase their posture. And then once you get past that acute stage, you can also add adjustments and some cervical distraction in there to alleviate the pain.